Morning, everybody. And here I'm coming here to talk to you all more out of a passion because I do see a lot of women going through postpartum issues, and not all of them might be of psychiatric importance, but some of them can be normal. And I respect every woman who's here who probably has gone through some amount of anxiety, depression, and to those who have had a uh, symptoms which might look like a mental health issue. So, to introduce ourselves, we are a mental health service provider. Our company name is Pearls for Development, and our mental health program is called as Amita Care. And our focus is that anyone, anywhere, at any time should be able to receive the services, and that's what our focus and agenda has been. And we also provide quality mental health service. When I say quality, we look at professionals who have been trained in clinical settings, which means that they should have an MPhil and above post their master's degree. And we pick up people from organizations like NEMANS, CIP, or LGB. So let's, as uh, Priya said, that perinatal mood disorders are very, very common. And you probably, if you throw a ring around, you'll find at least one person who will tell you that, yes, I've had problems. And the interesting part of the whole thing is that it doesn't mean that you should be poor, rich, or anyway, or even if you are a doctor. So we have a doctor who will now speak to you, who's who's sharing her. I did not pick up the video. Yeah, I'm sharing a video of a doctor who has had postpartum depression, and she has spoken about it, about her own problem. I'm not able to get thing. Okay, I'm not getting the video. That's fine. So let's look at it, how frequent and how common it is that we see in mothers. So if you look at the global data, including the India data, we have 1 in 5 women, that is around 20% of women who have had some sort of mood disorder during the pregnancy and the post-delivery process. So when we say 1 in 5, we are not saying about people who have anxiety, simple anxiety, but we are speaking about people who have clinically diagnosable illnesses. The difference, you need to understand the difference between, all of us feel fearful, but fearful being functionally problematic is what we are saying. It's not just about women, it's also about dads. So when you look at the men, it is 1 in 10 men who have postpartum issues or perinatal mental health issue. And the problem becomes more complex when you're poorer, when you're of color, when you're from a marginalized space. And the saddest part of the whole thing is less than 15% receive treatment. And at least 1 in 7, like if you look at 7 women here, at least one of them would have had some symptoms of depression. And it's not just mothers, it is also other family members. Why does it become more and more important? It's become globally, we are entering into a culture which is anxiety and depression driven. And so over the years, we will see more and more women having such problems. Now, the question that is raised is it only baby blues or other real perinatal mental health issues? Most of you all might have thought that, yes, oh, all of us, often hear that the statement made, hey, they are just baby blues, yeah, or mummy blues. But there is a difference between the two, and there is something that one needs to be aware of and try to see how we can seek services. Now, let's look at this lady called Shanti. Shanti has been a homemaker, married 1 year back, and she's just generally happy and was very dependent on her husband taking her out But somewhere during her pregnancy, she realized that she started becoming very nervous. Why does she become nervous? Because every time she used to go around with her husband, now she has to now go to the doctor alone at times. She gets irritable that her husband is not accompanying her, and she tries to convince her husband and her family that her husband should come with her. Without that, she cannot go, and she starts feeling anxious. Sees that her heart is beating faster, and she's like she's not able to travel anywhere. And that's the reason that she gives. It looks like a normal story, but here is a woman who has probably anxiety attacks or a panic attack. And this is not the first time that she's faced this. She's also faced this before marriage when she was traveling in a bus. She suddenly felt that everything around her was making her feel dizzy. Her heart was pounding. She was trembling. She after that she stopped going to movie spaces, closed spaces, shopping mall, and everywhere she went, she needed a person to accompany. Are you all able to connect with this lady? I suppose a few of you all will be able to connect because we see that in our everyday lives. Someone has raised a hand. Yes. Would you want to ask a question now or later?
No, I think they were just responding to your question. Yeah.
Okay. Okay. Fine. So you have Sandhya, who's another woman. She's in the 6 months of her pregnancy. She's been complaining that she's getting severe headaches. And when she's saying, and when the doctor checks her, they say that no, she doesn't have any reason why she should get a headache. It's a simple tension headache. And when you talk to her, she tells you about a story of a mother-in-law and she having problems with each other, and she gets very irritable. She doesn't feel like now getting out of her room. She's more often on the bed, not talking to anyone, not wanting to go anywhere. Her sleep patterns have disturbed, her eating patterns have disturbed. The doctor is telling her that you're not gaining enough weight. Her husband was quite supportive of her. Hears her speaking to her friend, and she has been expressing that she's feeling suicidal, not feeling like doing anything. She's not feeling the interest, and she's not enjoying anything that she does. Again, this is a story we hear very often from the current day younger generation who have had a lot to do in life, but once they get married, they are like more cocooned in their house. They have to interact with your in-laws, and then sets in the phase of signs of depression. This is a little different case of Lakshmi. Lakshmi has given birth to her baby, and she has her family members have noticed that there are some changes in her behavior. She locks herself in her room. She doesn't talk to her family members. Earlier they used to think that Lakshmi was very cheerful, but now they see her talking to herself, muttering to herself, not taking care of herself, not eating well, not really doing things that she needs to be, like cooking and looking after the child. So these are the problems that she is saying, and she's saying that somebody is following her, somebody is like keeping a watch on her, there are machines connected with her. Her husband is forced to get her admitted in the hospital. Do you think her husband did the right thing by getting her for treatment? Because there's also a component. So what if it is true? Yes, this is also a type of problem that people post delivery see notice. There's also another component when we see that women who have had long-term issues, like they might have, here you have Sugandhi who has lost her mother at a very early age, and her father had got married again. And Sugandhi did not receive her care and support from her stepmother. She started growing up with this feeling of emptiness, not getting into not really feeling that anyone cared for her. In the process, she falls in love with the auto driver, and she runs away with him. She becomes pregnant, but because she was unmarried, her stepmother forced her to get into an abortion. So once again she eloped with him and got married. Now she's become pregnant again, and she's constantly thinking, should I carry on with the pregnancy, because her marriage is not settled. She's having disturbed sleep, lack of interest in life, and thinks that she should end her life. She has injured herself twice. And in the past also, she has had self injuries. The only thing is that her husband saved her in this context. We have another woman here, Geeta, who is from a middle class family. She has two girls, and she's currently 6 months pregnant. She has complained of sadness, fatigue, tiredness, lack of concentration. Her husband and in laws wanted her to have a baby boy. Incidentally, she's given birth to a female girl. She feels that her husband is beating her. Not Her husband has started drinking alcohol after the birth of the child, or rather, increases drinking over the period. Uh, Geeta is worried that if she goes and complains in the police station, there'll be police involvement, and they will take legal action against her husband. She's feeling helpless. She wants to go and kill herself. But again, her family members have been supportive and have brought her to the hospital. These are cases that we all see every day in our lives. Many a times we think that these are very, very normal things that happen in our society. But let me tell you, a lot of them are closely entangled with mental health issues. Why do we say that they are entangled with mental health issues? Long term stress creates a sense of chemical imbalance in our bodies, and we are likely to have anxiety, depression, or even other long term mood disorders or psychosis, which I spoke about, where the woman was muttering to herself, hearing voices. The risk factors are several, because you can have women who have multiple pregnancies, HIV infections, previous histories of miscarriage, being on IVF, a child being born early. Younger women are more frequent, cesarean sections are seen. These are primarily because of the biological reasons. When you look at psychological reasons, there's a family history of mental illness, there might be past history of mental illness. A person may not have grown in a very healthy, normal environment, which gives her a strong self confidence, a sense of ability and coping skills which she can use when she is in problems. There are also other social factors that can happen, long term stressors. Domestic violence is a very, very common thing that a lot of women face and which doesn't get spoken about. There are women who feel lonely, feel that they don't have any supports, disappointed with the birth of the child, a lot of nuclear families, difficulties in relating to the in laws. These are little things that keep happening in everyday wise. Very often, what happens is that women might have been on medication before marriage, but when they get married, there's a sense of euphoria, a sense of well being, a sense of feeling good about oneself, and in the process, they stop their medication, and very often it leads to a relapse of symptoms. And when there is a relapse of symptoms, there's a possibility that during pregnancy or during post childbirth, the person has a relapse of symptoms, and that cannot be neglected, and one needs to be ensuring that it is not too wise to stop medication at the time of marriage. Now, how do I know I have a problem? Correct. So this is a small tool which you'll get online. It's called the Edinburgh survey, wherein there are just 10 questions. And in these 10 questions, if you, would you all want to score it? I give you all 5 minutes to score, and I'll tell you the answer.
Ma'am, can we share the link first with everyone?
Yeah, I will share the link. It is here. Can I share it little later?
Yeah, yeah, yeah.
Because it's there on the slide. I've kept the link. So you
Mm-hmm.
can look at it and then see whether the scoring key is also there along with it, and you can see whether you cross any score above 9 is considered to have is considered to be a person who has had some amount of distress and needs to see a doctor. So the scoring is 3 to 10. That is, the first one will be 3, 2, 1, 0. So anyone who gets a score of 9 and above fits in into the depressive or anxiety spectrum. So not, but the sad part of the whole thing is I told you 15% is the only number that receives care. So what happens? People think that pregnancy is a period of well-being. It protects people from psychological unease. But we must remember that 20% of pregnant women require services either during pregnancy or in postnatal period. We also know that mental health disorders, people think that it improves during pregnancy. You'll have heard a lot of people saying, she has one pregnancy, all her issues will get solved. Once she has a baby, things will get solved. But the fact of the thing is that pregnancy and postnatal issues actually aggravate during pregnancy, and many times people have more complications during that period. And if you have not received treatment, it's not just you. Your baby is going to be affected, your marriage is going to be affected, and you're starting on a wrong footing. So it's important that you put the footing on the right space, seek services, and put yourself back into care. This is the same thing that I said, that mental suffering does not affect the pregnancy, the fetus, or the newborn baby. What we want to tell you is that the outcomes are during pregnancy, because your health is not okay during your pregnancy days. You might not be eating well, not taking care of yourself. So the baby that is born, the fetus that is born, may be slightly compromised. It can also have complications during your delivery, like a lot of women now wants natural deliveries, and you may not go in for a natural delivery because there are complications during your pregnancy period, and your delivery may not really, might lead to complications, and people, the child might be born underweight, the child might not be born really robust and strong enough. And post delivery also, the mother child bonding, because the whole crux of relationship between a mother and child is on the bonding, because the bonding really decides your breastfeeding, bonding decides the child smiling, this bonding decides the way the child grows for the next 40-50 years. So during this period, why this becomes important is that the formative years of the child are slightly disturbed at this point if the mother is depressed or anxious, and the damages can be long term. uh, a lot of people think that taking medicines during pregnancy is not really good for the child. It can lead to malformations in the baby, or it might not be good for the whole pregnancy period. The fact of the things are that there are newer generation drugs which have very little impact on the baby. It does not move within the uterine sac, and so the child really does not get affected. Rather, if the mother is not treated, the possibility of the child having psychological consequences, the growth consequences are much higher. And so, if a woman is having problems, then it's better that the person seeks services. Having said that, I want to tell you that every postpartum issue is not medicines. It can be counseling. It might be uh, helping the couple to really set a right equation, helping the woman to really relook at her life in a much more better perspective, helping if there are personality issues, how do you deal with those issues, how do you sort out with issues with your in-laws, husband, within yourself. All these get matter during this period, and once this is settled, the next 25 to 30 years of your marital life can be much better and of better quality. There's a sense of feeling that, oh, anxiety and depression is a problem of the higher ups or people who are weak minded. Let me tell you that to come for treatment, one needs to be strong. A person who's weak will not be able to come for treatment because the person is still not ready to open up, still not ready to really talk about a problem. A person who's able to come out is now coming to a phase where they become stronger. I know that I need to get stronger, I need to move up the thing, I am open to seek help. And that is the reality of it. And if you don't treat it properly, then as a mother, you're dysfunctional. You want the world to circle around you and bring out changes, which in a way disturbs the equality space within the couple, because husband gives, wife gives. And when you start working on a framework where you're getting certain things because in your emotionally low state, you actually reduce the chances of you getting things when you're in a healthy state. There's a general feeling that oh, depression and anxiety will remit by itself. It resolves spontaneously. However, the reality is that it does not. It takes at least 1 year or even more for people to set a proper equation, because till the child starts smiling and till the child is able to really give that energy to the mother is struggling, and by then the marital relationship has gone for a toss. Now, generally, people, this is the discussion I had with Priya, and she said that, okay, PPD. I want to tell you that it's only not just depression. There are different forms of illnesses that happen during pregnancy. One part is depression, one part is anxiety. There are other things that happen which is on the spectrum of the obsessive compulsive disorder, wherein you have seen a lot of women becoming very touchy when the mother-in-law touches the child, somebody else touches the child, to the point they're becoming so obsessive and cleaning everything, feeling that others are not clean around you. There are a lot of these things where they become very, very regimental, use a lot of what to say, wipes, and a lot of, to the extent that it becomes pathological. And there is something called a obsessive compulsive disorder. So without doing certain actions, they don't get the anxiety. Anxiety gets very heightened, and that's also a problem that women which comes in during the post delivery period. Sometimes it might come in the perinatal phase also. And the last one is the psychosis, where I said about hearing voices, feeling that there's a lot of disorganization in the person's personality. There is a lot of hearing of voices and delusions that can happen. Okay, what are the common signs of perinatal mood disorders? As I told you, there are different four types of mood disorders. So all the symptoms may not be uniform, but there are certain commonalities which you all need to know, because if there's a psychosis, the chances of the person getting admitted in the hospital is very high, because there are obvious symptoms. Sometimes they occur in low grade and it becomes difficult to identify for families, but majority of them, the disruption is quite high. So if there is a persistent, the persistence is a key word. Like generally when I'm sad, I'm able to bounce back in a half an hour to 1 hour period, correct? Most of us, if you have something disturbs us, we are able to bounce in half an hour to 1 hour. But if I'm not able to bounce immediately, it becomes persistent, and persistence continues for a day, for a few hours, few weeks, few months. Then there is a concern that one needs to be aware of. There's a lots of interest in things that we normally do. Many a times, all of us have some ways of relaxing. We might do some gardening, some of us might go and see a TV, somebody might go and meet friends. So these are ways in which we live our lives. But when you are not in that state, you're not able to enjoy these things. I don't feel like you hear a lot of people, I don't like to go and meet my friends. I find it such a problem these days. I can't go and watch the TV. It's like it's very difficult to really look at it and hear it. There are people who complained about sleep disturbances. They say that I'm not able to get to sleep, or I'm getting up early, 3 o'clock. Or there are people who might say that they have intermittent. I sleep, I get up, I sleep, I get up. So there are different patterns of sleep disturbances. Some even sleep during the day and do not want to sleep during the night. The energy levels keep changing. The person is not having the same energy that the person had, and there are changes in the appetite. And people feel a sense of intense anger and anxiety, and they have difficulty concentrating. Yeah, that's it. So these are the little things that I would want you all to know. And That's where, and remember that all of us are at risk, all of us have concerns and problems.
आप क्या खाओगे दिन का बल्ले?
Yeah. So now
MS और
coming
सिल्क.
now, what is it that we can do in terms of treatments? Because that is one important part that we really need to look at. The first part of the treatment is that we need to understand what is the type of illness that the person has. Is it postpartum depression? Is it postpartum anxiety? Is it obsessive disorder? Is it psychosis? Or is it just normal stresses which are not of clinical importance? So, if the person is having problems which are very individual driven and there are lesser of family driven aspects that are there, then we go with individual therapy. Many a time, the individual problems are so big, even if there are smaller problems within the family, the individual problem might really stand up. Like, I have a woman that I'm dealing with. This lady has had childhood trauma and severe childhood trauma. Husband is fairly considerate. Husband is very caring, yet is more caring with the in-laws, and this lady feels that she should be taken care of first. Now, unless until we help her to deal with her trauma, there is little that you can do in the marital space, because every time the trauma space keeps increasing, keeps coming up again and again. So there are points when we do individual work, and most of the treatment that we do are either in terms of interpersonal psychotherapy or in terms of cognitive behavior therapy. Sometimes we do narrative therapies. Now, if it is a family issue, for the family issue, we need to do family therapy or couple counseling. So that's the other part that we really look at, whether we can do couple counseling or family therapy. The third part is in terms of how do you really build social supports and networks for the woman, because that's another part that you really need to look at, because many a times our current day cultures have made us alone and not really been into the space. So that's the next part that we really look at and try to see whether we can bring in as much of functionality as possible in the woman's life. Yeah. So I'm closing it here so that whatever is there, I can take it after your questions. Can we open all the mics?
Yeah,